Welcome to a video about what happens to a person when you arrive at the emergency unit with symptoms of a stroke. I'm Dr. Engelbrecht and I am an emergency physician. When someone develops symptoms of a stroke, like a weak limb, difficulty to speak, loss of balance, or anything like that, it is crucial that they seek immediate medical attention. Quick treatment is important to provide a good outcome for a patient. So if a patient arrives at the emergency unit, they are quickly assessed by the emergency medicine staff. Vital signs are taken, like the pulse, the blood pressure, the glucose level and oxygen levels. The patient's symptoms and signs are assessed and the severity of the stroke is assessed. What is also important is to know what other conditions the patient might suffer from and the medication the patient is taking. Families are important here because sometimes the patient can't give us the history themselves and the family can provide that to us. Once we know the patient is stable, the patient is sent for an urgent CT scan. The patient can also get a CT scan with an angiogram or an MRI as it's deemed necessary. Once the patient is back, the patient is still continuously monitored for his breathing, his blood pressure and pulse, and all the other vital signs, and of course, the progression of the stroke symptoms. There are two kinds of strokes, hemorrhagic stroke and ischemic stroke. We can see an hemorrhagic stroke on the CT scan as a bleed in the brain. The other kind of stroke, which is the ischemic stroke, is when a clot blocks the artery that supplies blood to the part of the brain that causes the symptoms of the stroke. So if it's assessed that the patient has an ischemic stroke, we need to give the patient a clot-busting medication, which is called TPA or tissue plasminogen activator. This medication needs to be given within the first 3 to 4.5 hours, preferably. This quick administration of the medication ensures an improved outcome for the patient. During this time, people often ask us what the outcome of the patient will be. As emergency unit doctors, it's very difficult for us to predict the outcome. This is dependent on the individual, like the age of the patient, comorbidities of the patient, the size of the stroke, severity of the stroke, and medication the patient has been taken. Once the patient has then received the medication and we are sure the patient is stabilized, the patient will then be sent to the ward to be taken over by the neurologist and the rest of the stroke team, which are your rehabilitation therapists and the nurses. So in summary, it is very important to get quick attention if you have symptoms of a stroke. It's difficult for us to predict the outcome of these symptoms, but with time, rehabilitation, therapy and support, a patient can work towards regaining the previous abilities. I hope this video has given you some more information about what will happen with you or your loved one when you arrive at the emergency unit with a stroke.